It is very common for men to have some discomfort after the procedure. We don't realize this as guys, but when we're sitting down, we're actually sitting on the back third of the length of our penis, and the penile implant will include that portion of the penile tissues. It's very normal to have some discomfort that oftentimes requires pain medication. And so before the operation, we will discuss pain medication options, determine whether there are certain medications that have worked well or have not worked well for you in the past, and decide together about the best way to move forward. In the days after the procedure, it is very common for guys to do well with Tylenol, and once we're about a week out from the procedure, we can start taking ibuprofen as well, if that works well for us. Swelling is a common experience after penile implant procedure. This is a part of the body that, of course, can shrink and enlarge very commonly and very easily, and so it's very common that we might have some swelling in the scrotum, in the penis, or in the tissues just above where the penis hits the belly. Rest and ice are the best ways to minimize that swelling. Once we're able to tolerate it, I also recommend wearing tightly fitting underwear or compression shorts. That can minimize the swelling. But taking it easy, putting our feet up, having an ice pack on the tissues, certainly in the first few days after the procedure, is the rule of the day. Your incision will be closed with dissolvable stitches, and skin glue will be placed over the incision. There's no special care that you need to take for the incision site, and it's all right to shower the day after the procedure once the drain has been removed. I recommend that guys avoid submersion in water. That is to say, no hot tubs, no tub baths, no swimming pools, no trips to the ocean, for at least 2 weeks after the procedure to allow the incision to heal. But again, showering and letting soap and water run right over the area is totally fine the day after the procedure. In the operating room, I will place the pump in the scrotum in the place that I think will be best for you to feel and operate the implant. As soon as you feel able to do so, even within the first few days after the procedure, I encourage you to feel around the scrotum, to feel for the pump, and to gently pull the pump downwards to an area of the scrotum that you feel is ideal and most comfortable for it to sit. That will encourage the pump to heal in the perfect position for long-term use. Although pain medications are often necessary for the first few days after the procedure, they can unfortunately cause constipation. I would encourage you to make sure you have enough fiber in the diet, whether that's through the addition of fruits and grains, or the addition of stool softeners, which I would commonly prescribe along with the pain medication. Stool softeners are typically taken twice a day and can help to prevent against the development of constipation, which is obviously a problem because straining to have a bowel movement can be very uncomfortable and potentially can cause a little bit more swelling and even bruising after the procedure. Although showering is safe to proceed with the day after the procedure, once the drain has been removed, I recommend that we avoid any submersion in water. No hot tubs, tub baths, swimming pools, or ocean swimming for at least 2 weeks after the procedure. During those 2 weeks, I also recommend that guys minimize what they're lifting. I really don't want guys lifting anything heavier than a gallon of milk or the Sunday paper for those first 2 weeks after the procedure. And if we have to extend time off of work because of lifting restrictions, we're happy, of course, to do so. It's typically safe to drive within a few days of the procedure as long as we're no longer requiring pain medications. Certainly we don't want guys to be distracted on the roads. From the standpoint of return to work, oftentimes it comes down to what type of work guys do. Office work or work that does not require much in the way of heavy lifting, oftentimes guys will go back to work in a week or so. For guys who do more physical labor, physical work, it may be 2 weeks that we recommend staying off of work. That's part of our preoperative discussion to come up with a plan together for how to proceed postoperatively. Recovery after penile implant procedure can vary, but typically is around 2 to 4 weeks before we start to feel comfortable with manipulating the pump and maybe inflating and deflating the implant. Most men are ready to proceed with sexual activity somewhere around 4 to 6 weeks after the procedure, and I routinely see guys back in the office about 4 weeks after the operation to go over inflation and deflation and for their initial postoperative exam. Most commonly, the first appointment after surgery is about a month or so after the procedure, and that's something that my office will schedule after the surgery date. I'm certainly happy to see guys sooner if there are questions or concerns, and please don't hesitate to give me a call in that case. It's very common when I see guys back about a month after the procedure to show men how to inflate and deflate the implant, and for that to be the initial time that it's used. Sometimes, about 2 weeks or so after the procedure, guys feel comfortable proceeding with inflation and deflation or even sexual activity at that time. And that's fine, that's safe. About 2 weeks after the procedure is okay. But typically 2 to 4 weeks is when we're ready to start using the implant. If you have questions during recovery, please don't hesitate to reach out either through the patient portal or by calling my office, 614-396-2684.